So the intervention in reducing the risk of cardiovascular disease in chronic kidney disease. The first one strategy includes control high blood pressure and also control hyperlipidemia. So for both of these, what we can do is by using the lipid lowering agent where we can reduce the hyperlipidemia and also use of antiplatelet agent. So because if our red blood cell is going to clog together without these antiplatelets agents, then it will cause a narrowing in our blood vessels, which in turn will cause elevation of the blood pressure. So by prescribing the lipid lowering agent and also the antiplatelet agent, it can help to achieve this strategy, our aims. Control high blood pressure as well as control the hyperlipidemia. So it's stated here also, secondary prevention is using antiplatelet agents. Okay, now we look at lipid lowering agents. So here, the green one is what we have to do. The statin should be offered to patients with chronic kidney disease for primary and secondary prevention of cardiovascular events. So here we have primary prevention is by using the azithromycin and also the simvastatin. Okay, and then secondary prevention study a patient with or without chronic kidney disease had reduction of cardiovascular events with the statin treatments. So this is the evidence why we have to prescribe lipid lowering agents to the patient. It will help in reducing the cardiovascular events. Okay, so next one we look at the antiplatelet agents. Aspirin should not be used as primary prevention, while it can be used in the secondary prevention in a patient with chronic kidney disease. So next one, the combination of clopidogrel with aspirin should be avoided, not giving. We continue to the number 6 about the chronic disease with pregnancy. We have divided into strategy, pre-pregnancy care, and also pregnancy in chronic kidney disease. Here, we should so all the females patients of reproductive age with chronic kidney disease, they should receive pre-pregnancy care. And then here is stated that what should avoid pregnancy should avoid in women if they have moderate to severe renal impairment, poorly controlled hypertension, heavy proteinuria, and also the last one, active systemic disease. So this condition is difficult if a woman needs to plan for pregnancy. So here is stated that all pregnant women with chronic kidney disease should be co-managed by a multidisciplinary team. So just now we stated about the pre-pregnancy care, right? So actually what is this? Is the pre-pregnancy care is a set of healthcare and intervention give to the woman in their reproductive age before conception occur. So what include is the screening for medication and medical risk factor, and then we have management and optimization of medical conditions and risk factor. The third one includes the nutrition and supplementation as well as last family planning. So the last one about pregnancy in chronic kidney disease. It is dangerous for a pregnant woman with a chronic kidney disease because it will associate with increased risk. The first one is the maternal outcomes and also the fetal outcome. Let's see. The maternal, we will have gestational hypertension, pre-eclampsia. Eclampsia is so the maternal death. And while for the adverse fetal outcome, we have premature birth, intrauterine growth retardation, and also small for gestational age, low birth weight, stillbirth, and also neonatal mortality. Yeah. So, a pregnant woman with CKD, the risk will begin just at the stage number 1, and it will continue to increase the risk in a more advanced stage. So what you do is the pregnancy in patients with CKD should be planned, taking into consideration all the clinical status of the woman, pre-conception review of medication, and also the early referral for combined specialist care. And we have to notice here the S inhibitors and also the ARB should be avoided in pregnancy because both of these drugs is teratogenic.